So this is something that is called metronome therapy, which I didn't
Mm,
never knew was a thing
mm,
until quite recently.
mhm.
And it it involves doing those kinds of movements where you engage parts parts of your body bilaterally or with whatever complication is needed to make it harder to do. So you
Well, I
could
mean, it really struck me that you're getting the like how ideally you'd be walking, and it would be the opposite arm swinging from the
oh
leg.
yeah,
That's,
yeah, right. But we're not for reasons maybe I'll explain later. We don't want to apply this to walking particularly, but
no,
uh,
I just that I
yeah,
made
right,
that connection that we were using the arms and the legs, like in crawling as well, or so.
right. So a couple of things. You might, if you so feel so inclined, try this with some people, perhaps your husband.
Hmm.
Just see if they can do it, you know, and or if they have a if there's some kind of default, if they default to right arm, right leg,
Hmm.
left arm, left leg,
Hmm.
which is
Hmm.
very common in people with brain damage or um, and also the this metronome therapy is mainly known for helping children who have developmental issues. So even a simple thing like this, clapping,
Hmm.
they may not be able to do that at
Hmm.
first.
Hmm.
They're bringing just bilateral across and then
Bringing it together, yeah,
bring it
okay.
together. And if you then combine that with foot movements,
Mm.
pretty quickly, they're going to have trouble with that. And when they practice and using the metronome to kind of keep them honest in terms of the time, the
Mm-hmm.
everything everything coming at the same time, the
I
clap.
could see that
But
for some people, the metronome would kind of make it harder. For me, I had the experience of having a steady beat, making it easier. I mean, and my way for managing it on my own when I didn't have it was to, oh, I need to recreate that beat in myself to be able to keep steady and keep things going. But I know for some, I'm very used to that from
what you use because you
musical background years
musical
ago.
background, yeah.
And
So
that's
yeah. So the other places where it has been shown to be effective is people with Parkinson's disease. There's
mm,
quite a bit of several studies on that. There are also a couple of smaller scale studies on just elderly people,
mm,
and they it is generally most often used by occupational therapists
mhm,
working with children and Parkinson's. But there's a pretty good case that could be made uh, that has been made by some physical therapists that this would be a really good thing for physical therapists as well.
mhm,
And I'm wanting to make a case that this could be a really good thing for Alexander teachers
mm,
as well. Because what the Alexander technique can bring to this is, well, first of all, you might say another layer of complexity. You have to
mm.
think in Alexander direction as you're doing this. So that's,
Could also be another layer of support, though, too, right?
yeah, yeah. Well, I mean, what you're doing in this process is you're moving parts of your body. And obviously, you can move them better or worse in terms of just the quality of the movement. So that's where I think the Alexander technique comes in.
Absolutely. Yeah.
And I want to just make it clear to everyone watching this, I am not an expert in metronome therapy. I really just learned about it in the last month or so. But to me, it seems like a field that anybody could start to practice working on their own. There really aren't any hard set rules about how to do or what you should do, but you're just putting little challenges that involve uh, particularly left-right hemisphere activities. And
Mm.
those can be a problem for kids sometimes developmentally, and that's what it's best known for. But also strokes, Parkinson's, anything like that. Uh, and
Um, ca-
and
can I ask about, you were quite specific with the beats per minute. Um,
yeah,
and
40.
I'm just curious about
Well,
that.
40 is pretty low. It's a
Yeah.
good introductory one. Some people in this world of metronome therapy believe that 64, I just wow, rounded up to 65 beats per minute is a kind of optimal in some way. I can't
64.
say that
Okay.
I understand exactly why it's optimal, except that if you got too much faster than that, it gets really difficult. But 40 may not be much of a challenge for people. You might want to move it up to the 50s or 60s.
Hmm. Hmm.
And m- my overall take on this from an Alexander perspective is that in some ways, you could think of this as like an Alexander procedure of the type constructive rest, hands on back of chair, monkey position. Those are all physical movements or places you put
Hmm.
yourself in and that lend themselves to Alexander when combined with some Alexander thinking,
Hmm.
um, could be really useful, or even just useful on their own. Constructive rest, you think about it, especially if you do the version of constructive rest that I like to do with new students, which is just putting support under your knees. So you're not even having to worry about your legs falling in or falling out. Just being there, gravity's operating on you in quite a different way, and there are benefits of that, and they can be enhanced by Alexander directing. Once you've gotten good at just lying down, you can now add some thinking to it and get even more benefits. Same thing with monkey or uh, hands on back of chair. Well, I'm trying to think of some others, but a kind of a procedure. It could be a useful procedure for Alexander teachers who are, after all, often working with people who had some issues
Hmm.
that might be very much helped by this.
Yeah, and I think really I can imagine like when you're first introducing the movements, really taking time to work with your students to direct and be using themselves to the best of their ability while they do it, and then building up so you're not practicing them doing it in a
Well, there's different,
or but I think there's also something about the rhythm that kind of gets you out of a habit a bit too, if
yeah.
you can connect with it. Anyway, there's different ways, right?
Well, I think in general, the people who do this want you to get started, maybe even without the metronome, just to do the basic movements, and then, but fairly quickly introduce the metronome to make it really precise.
I was just imagining a student, if you could see every time they were doing something like,
Yeah, you could,
exaggerating, you would want to not be reinforcing that. I'd want to back off and like, well, can we just, you know, tap on the leg without involving the neck, for instance?
right, right. But one way to do that let's say you're doing the left to right tapping leg movement.
Mhm.
Each beat, you're not only making those movements, but you're maybe making, if you use a really simple Alexander direction like I'm free, you just bring I'm free. You could even just
Exactly.
say free. Now, I prefer the I'm not thinking direction in general. So
Mhm.
I'm not think I am not thinking. So it's like four stages, beats.
So
As
you get it in the rhythm. I kind of do a similar thing. There's
yeah.
um some practices that we do with in my groups that this comes from Mia Morales called potato, but it's moving the hands. But
Hmm.
then we've practiced it for ages with our constructive thinking going quite slowly. Then we play with, because we know the movements, that you're just in this rhythm, but that's the rhythm of your thinking. And I'll prompt with a ease, 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 ease,
Right, right.
ease. So it's the same idea that, or it could be I'm free, I'm free,
Yeah,
I'm free,
yeah, yeah, absolutely.
um,
That's exactly. And you could one way to do this is if you're lying down, maybe it could be in constructive rest or lying down, getting ready to go to sleep. Have the metronome on and just do some a little movements as you're lying. It could be just combining a little movement of a right foot with um, a
with
left
the
something,
just a little tiny. I was thinking doing
a
something in
hand, maybe
constructive
a
rest.
hand, the little hand movement and combining right hand, left leg, and to the beat. Very small movements, so you don't, if you're going to
Yeah.
bed, you don't toss the blankets all over the place, but you could even end up falling asleep to the metronome. And there's a little bit of talk in some places that that itself could be useful. You're sleeping and the metronome's going and each ear's getting its own version of it and blah, blah, blah. So there could be that.
Mhm.
Um,
That's interesting. I was also just thinking, just if you're doing constructive rest during your day, like you say, there's a little movement of the hand and the opposite foot and the other hand, but that's also a really good place because you've got the support of
you
the
you got the
surface under
support.
you that you're not doing anything extra while you're doing these little
Yeah,
movements.
yeah,
Yeah.
yeah. No, I think it would be a perfect thing for constructive rest.
Mhm.
Yeah. So I think
Very interesting, Robert. Of
yeah,
course, I'm delighted I was able to
I'm I'm
do it, which
I'm
which is not the point. But I'm human
well, I
too.
think you'd be a really good demonstrator. What I'm gonna do with this, and I'm gonna do a few other recordings, is put links to some pages that physical therapists have where they've explained a little bit what this is all about and why they think this is really appropriate for PTs. That's kind of interesting. And also, there's a YouTube playlist video of a lady demonstrating multiple movements that you could make standing.
Mm.
Just like you could come up with zillions of combinations.
Hmm.
If we really wanted to push the limit with you, we'd speed up the metronome. We'd have you doing quite different things with your hands than with your legs, maybe tapping your head or hitting gently, but something that was very different to what the feet are doing or the legs are doing.
Yeah, yeah, yeah.
And
Interesting.
there's
So,
multiple ways to make it more complicated, which I don't actually know yet at this point because I'm learning all this from a PT who works
mhm,
in rehab at the hospital I was in.
mhm.
And it's I'm hoping to do an interview with him as well. because his reason for getting into it, which is kind of interesting, he's been a PT for many years, is that he notices that he can help people strengthen them, do strengthening and doing this and that, but there's still something not right. There's still a discoordination that isn't helped by just exercises,
Mm, mm.
strengthening. And he stumbled onto it and is
Oh,
uses it. He uses it as he would put it, mainly for as people who have issues with too much sensory overload issues,
okay.
which is very easy to have when you have a stroke or something like that, because
Mm.
the channels between the two hemispheres are a little messed up, and now a hemisphere is being, and with this, you're asking the right hemisphere to do some things that it normally wouldn't be expected to do.
Ah,
The left.
okay.
If you've been doing this a lot as a musician, chances are it's not as much an issue for you.
Mhm,
But
mhm.
uh, anyway,
Well, it's not a channel
Andy's
I've
not
been
a
working with.
musician. Andy's
Yeah.
not a musician, right? He has no background.
No, I will try with my husband. So is your idea though for our viewers or listeners that other Alexander teachers could try this and experiment with it themselves and with their
Yes,
students and
yes, I think so. I think
yeah,
it'd be very
as
interesting to
another
try this.
as
Yeah,
another kind of activity in which to explore
exactly.
our work. Mhm.
And there is one of the things that a distinction that's made, and I gotta make sure I get the terminology right, um, is there are there are they don't, for example, recommend doing this, except for Parkinson's people who walk very, very slowly and
Mhm.
carefully and not.
Mhm.
But in general, they don't say this is something that would be useful for bike riding or walking because things like we did just now, the left,
Mhm.
right, that carries over into other things. And they have a
It's
term.
kind of naturally happening in those
I don't find the exact
bicycling or
word.
walking. Yeah.
Um, yeah, the term they use is it's useful for general domain sensory integration exercises. So exercises that are not really just for themselves, but for all your activities.
It will flow, what you build up that capacity as you're doing them will flow into everything else you do, basically.
Right. But something like walking or cycling doesn't fit that. But something like walking or cycling, those are activities that right away might call for Alexander.
Mm.
They may not be good general domain metronome therapy things, but you know,
Yeah,
Alexander could probably help people unless they're perfectly coordinated and
absolutely.
so
Yeah,
on.
who is?
Yeah.
Yeah.
So,
Oh, this is
yeah,
fascinating, Robert. Thank you.
yeah,
Yeah.
you're welcome. So, you have any other questions that you think people might have? And by the way, we're talking about here a little about Alexander technique and metronome therapy, but someone watching this certainly does not have to know anything about the Alexander technique to explore this.
To play with it. Yeah.
Yeah, and
Uh,
you can go quite far with this without any. One of the beauties of this doesn't require any equipment. You have these nice metronome apps that are available on your phone. The one that you're using, I think, is called Metronome app or something, but there's another one called something like really easy metronome, I think it's called, that I think
yeah, it's
you
just a
have.
free metronome app. It was very simple and it worked fine.
Right, but there's another free one, I think it's called Easy Metronome, that allows for this kind of complexity. you're doing stuff to the beat, but you can set it so that for every certain number of them, the tone changes once and you have to switch to something else and then switch back again after five or four or whatever you set.
Mhm,
And again, another layer of complexity,
mhm, mhm,
another
mhm.
layer of complexity. So
Yeah,
anyway,
very interesting. So no further questions, just I'm eager to explore this a bit more
yeah,
myself.
see if you
So
can
thank you.
find some people to explore it on.
Yeah, I have my sights on a few.
And who knows, we might want to do a follow-up interview based on your experiences. Okay,
Sure.
well, my guest today has been Imogen Ragone, an Alexander teacher in Delaware, Wilmington, Delaware. And I'll be posting this as a YouTube video, and I will include in the description the links to some those couple of articles by PTs, a series of video that shows lots of possible movements, and maybe some other stuff that will be relevant. So you can do it. You can do a search for metronome therapy, and you'll see a lot of stuff coming up right away. And a lot of it'll be kids, but also for Parkinson's, you'll see those too.
Thank
Okay,
thank
well,
you.
thank you so much.
You're welcome.